Well, we're talking about how sciatica is a big reason that you could be suffering with pain, but good news, y'all, it is treatable. We've got Dr. Jordan Floyd here with Limitless Therapy and Wellness to kind of talk about it. When I hear sciatica, it brings me back to when I was pregnant. And, you know, right there, it'd be like just crazy pains.
Yep, and so one of the reasons I wanted to talk about it is because we use this term sciatica because people know about that big nerve that runs down your leg.
Yes. Well, where does it actually, it emanates from your spine?
It actually does, yep. So it's a cluster of nerves that comes from your spinal cord, and it supplies all the sensation to your skin, your muscles, and your strength going down your leg.
But when she calls me a pain in her rear, that doesn't mean...
That's just one of my pains.
That's not the same thing. So you see one of these pictures here, one of the reasons that we can actually have that pain is actually coming from the spine itself, right? Yeah. So some people assume that because the pain is in their leg, the problem is in their leg, and that's not always true.
So it's misdiagnosed.
Oftentimes, yep. Or we have this...
wouldn't do that.
No, we wouldn't do that. But we have this term called sciatica, and people think that every time I have pain in my leg, it's always coming from that nerve that you see right there.
Right.
And that's not always true. So we want to talk about that a little bit today.
So what could be causing it?
That's a good question. Yep. So one of those causes we showed before was the picture of the back. This is another one where you can see this piriformis muscle that actually crosses that nerve, and when that muscle gets super tense and tight, it can cause those feelings going down the leg. And then another reason that we talked about off air was the hamstring muscle, actually, because it lives in that same area. And so people assume that because they're having pain there that it's coming from that nerve, and that's not always the case.
Don't sleep on your deadlifts, y'all. So
that's right.
You know what I'm saying?
That's right. That's exactly right.
2 locations, right? We can come see you?
That's right. Yep. We've got 2 locations in Greenville, one on Woodruff Road, one downtown, and then we still offer mobile service as well. So we'll go to folks' homes or offices if they need the help there as well.
What have you found that people may be doing wrong when they're trying to manage their pain?
Great question. I feel like the #1 thing that people come in telling us that they've tried is stretching their hamstring muscle because they feel tension or tightness in the back here. And the problem is that when you're doing that, you don't really understand how nerves work.
Right.
Because nerves aren't like rubber bands. They're not elastic. They don't stretch and recoil. They're rigid. They're almost like a rope or a guitar string. And so when we pull on both ends, it actually makes our nerves more angry. Yep. And so a lot of times someone will say, well, someone told me that I need to stretch my hamstrings. I'm just going to bend over and do this. And in the moment they think, maybe if I just grit through it a little bit longer, it'll get better. It can actually make it worse.
So that's bad advice.
That's right. Yep. So one of the pictures that I have on here too is actually a picture of that hamstring stretch that a lot of people do, where they're sitting and trying to bend over and put a little tension through that nerve, and that oftentimes causes the wrong reaction. So instead, nerves don't like to be pulled on both ends; they like to be flossed or glided. And so that's one of the things that I'm showing in this picture right here, exactly, where you can notice how you see how she's actually using some tension in her head to create a little bit of slack in that system going all the way down. Most people aren't shown to move or stretch this way. They just assume if I bend over and touch my toes and just grit through it, that maybe it'll release. And in fact, our nerves like to be gently glided and stretched instead.
Well, is it more of a woman or man thing?
Both, yep.
Really?
So she mentioned about pregnancy, and that particular picture was an instance of somebody that suffered through it in pregnancy, but anyone can experience these symptoms.
What about like rolling out? You know, does that help with
So
that?
specifically, if it's coming from that piriformis muscle here, then yes, absolutely.
Okay.
That kind of deep pressure or compression, we call it ischemic compression, where we force the muscle to relax, that can help. But again, if that's not where it's coming from, then sometimes it can make it worse. And that's why it's important to talk to somebody that can kind of get to the root of the problem.
So you can give us the proper diagnosis and get us on the table and manipulate what you do.
That's right. Yep.
And fix this.
So, and really the big take-home message here is just because you know where you feel the pain, doesn't necessarily tell you what the problem is. And so sometimes that one-size-fits-all of, well, I feel tight here, maybe I need to stretch it out, it actually makes a lot of people worse. And we want to help people avoid that.
Good advice.
And to make it more fun, sometimes because you have a pain here, it means you haven't done anything wrong here. You could be doing something wrong.
That's exactly right.
Places,
That's exactly right. It could be an encouragement in a lot of cases. That's exactly right. So we want to kind of take that top-down approach to say, hey, let's make sure it's not a problem at the spine, not a problem at your hip, not a problem with these muscles before we just jump and assume that you've got that pinched nerve in your hip there.
Give us the locations again.
Yeah, great. So Woodruff Road, right at the intersection of 85 and 385, and then downtown here on Toy Street, kind of historic district of Greenville. And then, like I said, we can come to you guys as well.
Limitless.
Yes, sir.
They are limitless. They know something about everything. It's crazy.
We try.
You do a great job, Dr.
Thanks,
Floyd.
Doc.
Thank you
Thank
so
you
much.
so much for having me. I
Very
appreciate
cool.
it.
Very good.